Declan, you're a urologist with an extremely strong CV on imaging. Why and how did you start to work with imaging?
Well, thanks so much. As a urologist, my main interest is in prostate cancer. And you know what? Imaging is one of the most fundamental tools that we use to help diagnose patients, to help plan the correct treatment for patients. And now, as I've learned in recent years, imaging and imaging-related technologies may even allow us to treat patients with prostate cancer. So for me, as a prostate cancer specialist, as a urologist, imaging is a key part of how we look after our patients.
Great. So you must meet a lot of nuclear medicine physicians. What do you think of us, nuclear medicine physicians?
Well, look, here we are at the world's best nuclear medicine meeting, the EANM here in Barcelona. I'm so happy to be here, but it's not a usual thing. This is the first time I've been in person at this great meeting. But it's very important for people like me who are interested in prostate cancer to come to this meeting.
What was the biggest success story you remember? What reached you personally with a patient?
I think when PSMA Theranostics came along, Judith, that was when we suddenly began to think, right, you can see these cancers, but by targeting them with these radioligand therapies, I think our early experience with that back in 2015, 2016 was, to me, eye-opening. I could not believe how these patients went from having, morphine and walking with a difficulty due to the pain in their bones to, easy therapy, no side effects, and they feel great.
So the best way to treat a patient is a multidisciplinary manner. What was your biggest hurdle you came across when you wanted to achieve that?
I'll tell you what the biggest hurdle was, Judith. Our multidisciplinary meeting takes place at 7:30 in the morning, and I couldn't get the nuclear medicine physicians to come into the hospital at 7:30 in the morning.
Boo.
Until I said, Michael Hoffman, you can have breakfast. I'm going to have you coffee, breakfast, come into the multidisciplinary meeting. So once we put the food out, the nuclear medicine physicians came in. That was the hurdle.
Great idea. Treat your nuclear medicine physicians with breakfast and they will come. Is the nuclear medicine physician who is participating in the multidisciplinary meetings, is he or she an active participant or only showing the images?
Here at Peter MacCallum Cancer Centre in Melbourne, they are extremely active. And that's because we value the role of the nuclear medicine physician so much. In a big cancer centre like ours, I'm the director of the GU oncology stream. It's fundamental, it's essential. If we have no nuclear medicine physician on a Thursday morning, it's a problem. But thankfully we don't. We always have a few physicians, fellows, as technologists and research nurses in the meeting. And this is all really important. They're all telling us something about the physics, the dosimetry, the patient experience, and so on. So I cannot imagine multidisciplinary meetings now without the nuclear medicine team.
So this is clearly an example to follow. Go to the meetings, participate, take the lead. This was Inside EANM 22. Stay tuned.